Spanking is categorized as an adverse childhood experience, ACE, a term used to describe various forms of childhood trauma, including physical and emotional abuse, neglect, and household dysfunction. Research shows that ACEs significantly increase the risk of chronic physical and mental health issues later in life. The stress of childhood trauma can lead to improper development of the nervous system, resulting in heightened sensitivity to stressors and chronic dysregulation. This dysregulation can weaken the immune system, making individuals more susceptible to autoimmune diseases and a host of other health problems. Statistical evidence underscores the severity of the impact of ACEs. For instance, individuals with 4 or more ACEs are more likely to experience chronic health conditions such as heart disease, diabetes, cancer, and autoimmune disorders. They also face increased risks of mental health issues, including depression, anxiety, and substance abuse. The link between ACEs and suicide is particularly concerning. Research indicates that individuals with a history of multiple ACEs are more likely to contemplate or attempt suicide in adulthood. Intergenerational trauma of spanking and its roots. Spanking is often seen as a normalized form of discipline, but it is essential to recognize that it is not a natural or universally accepted practice. Many indigenous cultures and African tribes historically did not use corporal punishment, viewing it as foreign and counterproductive. Instead, they favored approaches that emphasize compassion and community support. The introduction of corporal punishment by colonizers marked the beginning of intergenerational trauma for many families, perpetuating cycles of fear and control. Neuroscientific studies have shown that even minimal exposure to spanking can lead to changes in brain structure and function, similar to those observed in children who face more severe forms of abuse. This includes alterations in areas of the brain responsible for emotional regulation, impulse control, and cognitive function, ultimately resulting in lowered IQ and academic performance. Impaired impulse control, a common consequence of childhood trauma such as spanking, significantly affects an individual's ability to manage their emotions and reactions. When the brain's emotional regulation centers are disrupted, individuals may struggle with heightened irritability and anger, leading to impulsive outbursts or aggressive behavior. Ultimately, these challenges can create a cycle of maladaptive behavior that perpetuates emotional distress and further complicates their relationships and overall well-being. Addressing misconceptions and recognizing trauma. It is common for individuals who were spanked to dismiss its impact, asserting, "I was spanked and I'm fine." However, this perspective often overlooks the subtle, cumulative effects of such experiences.